Okay, guys, today we have another podcast and our guest, Dr. Joshua Hassan.
Hello,
Dr.
everyone.
Hassan,
Thank you.
thank you
for
for
having
coming.
me.
Thank you for coming. The first question, as usual, what's your story? How you become a dentist? What was your kind of story? It was your dream, or you just find out?
Actually, it was my dream. When I was a
Wow.
little kid, I used to sit on my mom's lap when she was getting dental work done and look up and watch it. And so for a young age, I thought I was going to become a dentist. And then it shifted a little bit when I got into college because my other passion is sports and I wanted to do sports medicine.
Wow.
And so I was thinking, maybe be a head trainer somewhere or, PT, OT, that kind of thing. Or maybe sports surgery. And then when I got into college, I realized I took a look around at my pre-med class and I was like, you guys are all crazy.
You mean the medical wise? Okay.
Yeah, like just so cutthroat and intense. And I was just like, I'm never going to survive this. So I quickly pivoted and I went back to my original love of dentistry. And my wife's aunt and uncle was a prosthodontist and orthodontist.
Wow.
And so I shadowed them and I was like, I love this. And I switched over to the dental track. And, we're probably we were a small college, so there's about 100 pre-med students. 5 of us were going to dental school, so it was really small. So that was it. I fell in love I wanted to work with my hands, and I wanted to take care of people, and I wanted to talk to people. I talk too much, my wife tells me.
Oh, yeah?
So I wanted to continuously talk to people and have relationships and long-term relationships, and that's how I fell in love with dentistry.
Wow. What dental school did you finish?
I went to Temple University out in Philly.
Okay.
Yeah.
It's close to Penn State somewhere, right?
No, it's actually close to UPenn, or Pennsylvania University. Yeah, University of Pennsylvania. Sorry. So it's they're in it's the University City.
Okay.
And then we are at North Broad Street, like downtown. Really terrible neighborhood.
Oh, yeah?
Like you'll see everything there. I remember we had a bunch of people from Utah in our class, and I remember the first day they're like, "Okay, so women, here's your rape whistle. Don't walk outside without the stadium floodlights on.
There's a whistle?
Yeah, don't leave anything in your car. If there's even a nickel get broken into, don't walk in groups at night, like." And you could see the blood drain off of some people's face, and I was like, "Oh yeah, this is a bad part of the city."
Wow.
Like it's North Philly. You see all kinds of crazy stuff, but that was the reason why I wanted to go there so badly, was because we got such a great exposure to everything. And one of the advantages of going to Philly, or going to Temple, as opposed to other dental schools, we didn't have a huge prost program. So we didn't have prost. We had ortho, we had endo, and we had perio. Oral surgery is there, but it was weird dynamic. It was actually by not even the medical school. It was by one of the medical hospitals. So they never rounded at the school. So it wasn't there. So you got to do a lot of advanced surgical extractions. You got a lot of experience. And so even restorative cases, right? We got a lot more experience because we didn't have grad prost, losing cases to. So it was really a great experience in dental school. Like restoratively, I did a roundhouse bridge in dental school and telescopic openings.
Wow.
Yeah.
But it's harder than...
As a dental student, it was impossible. It took me,
I know.
in dental school, you're going to laugh. It took me like a full year to complete the case.
Yeah.
But yeah, so we got great restorative experience. We had a lot of dentures, a lot of denture therapy, which for what you and I do for all ons, it's imperative to know denture setup.
Why did you decide to be perio? Like
why did I choose perio?
Yeah.
So I was on oral surgery track for 2.5 years. And everyone I met, everyone that talked to me, elder classmen, dentists, were like, you should not be an oral surgeon. You're not cut out for it. And I was, originally I was offended. Like, what do you mean? I'm not smart enough. Not good enough. And they're like, you're not the right personality. You're just not. You're not type A enough. You're not, you want to talk too much to your patients. You want to care about each patient. You're better for perio. However, at Temple and some other dental schools that I've been affiliated with, we do a bad job teaching what actual surgical perio is.
Okay.
When you're in dental school, perio is really, here's SRP, here's how you measure a pocket, here's And so it was a big joke in Temple that we're all gum gardeners, right? So I don't want to do perio. Who wants to do that? So again, I was on the oral surgery track. I was dealing with the oral surgery faculty. A lot of them were military trained. We were dealing with a very impoverished community at Temple. And I remember having to take out these roots on this broken down carry tooth. I think it was like number 13 or something in dental school. And my fellow dental students struggling. And so they wanted me to make a flap and like take the bayonet and crush the buccal plate and pull out the root because it's buccal. And I was like, yeah, but what if this person wanted an implant? You're like taking out their bone. And they're like, too bad. Like, that's not our concern. You know, and they judged them a little bit. And they're like, they can't afford an implant. So just do what I said. So I'm still like trying to not. And so it didn't go well with the faculty, and they screamed at me. I eventually crushed the buccal plate. I said, I didn't know you could do that, but crushed the buccal plate, took it out, filed it down, sutured up. And I was like, this doesn't seem like the right way to do it. And I was told, this is the way oral surgery is. Like, you do what we say. And if you can't, you're not cut out for it. So I was like, well, that was one bad experience. Then we got into the orthodontic stuff when we were in dental school lectures, and I was like, I have no interest in this. Like, I don't want to go through a training where I'm breaking people's jaws and like, I was just like,
But it's popular.
Oh, it's popular. Yeah. Don't get me, you know, people do it. It didn't appeal to me. Like I wanted
maybe we can explain what is it. It's just like you just.
So, right. Orthodontic surgery is when you have a skeletal malformation or discrepancy and you can't move the teeth or dentally compensate enough through orthodontics. So you have to realign the jaws. So basically they break the jaw, upper jaw or lower jaw. They either advance it or set it back. And it is a very intensive surgery for patients to go through. And don't get me wrong, it's cool. It is just not something I envisioned. Like, I don't want to do a year of orthodontic surgery because, let's be honest, 90% of oral surgeons don't do it in private practice.
They do in the hospital.
Yeah, some do it in the hospital, but if you refer in our area to orthodontic surgery, there's only one or two that do it.
Oh, yeah, makes sense.
They refer it down to the universities because they don't. A lot of them aren't affiliated with the hospital. Most of the ones I know, I'm not saying they don't take call, but some of them don't want to be affiliated with hospitals because then that means they have to take call and rotations and deal with traumas.
Weekends,
right? It's weekends. So a lot of oral surgeons that I know, again, I'm not speaking and generalizing for everyone, but a lot of the oral surgeons I want don't want to do that. So they want a cushy life. So what are they doing? Thirds, which they're great at, or some people call eights, but thirds and implants, right? So I was like, and I met with oral surgeons and they're like 90% of what we do, thirds and implants. I was like, well, I want to do implants. And so I just decided, like, I don't know about orthodontic. I don't really like the personalities. This isn't really working out for me. And then we had our surgical lectures on perio. And I was like, this is what I want to do. Like, you guys do this? And then you hear it doesn't hold true nowadays, but you hear GPs or the old school thinking that sometimes, hey, my periodontist does all my anterior implants, which are the hard ones. My oral surgeon does the posterior. That's not really true, but like I view myself more as like, a silent surgeon. Like, you don't know we're there. Like, we're supposed to be like a ninja, in and out. And we make long-term relationships with patients. And so I decided, I announced, hey, I'm not doing OS anymore. I'm going to go perio. And it shocked like all our faculty because that never happens. No one leaves oral surgery for perio at Temple. It was like, what? You're doing what? And I was like, I'm going to do it. I know I wanted to do a really heavy sedation program, so I do a lot of sedation. And so Chicago had one of the best programs for that at the time when I was applying, and that's how I got out here.
Chicago University or Chicago?
University of Illinois in Chicago. But there's only, at the time, don't forget, Midwestern wasn't around. There was only There's only one dental school.
Northwestern too.
No. The Northwestern, Loyola, they all closed. So the only dental school at that time when I was applying was UIC. And UIC had a really great dental anesthesiologist that let you guys, shout out to Dr. Zach Basia. He let us, really learn under him, and we had a whole hospital rotation. Right, a lot of perio programs weren't doing that. They weren't bringing out a certified dental anesthesiologist. They were bringing in another periodontist. And a lot of the residents, some programs, they weren't placing IVs, and it was like, no. that's not what I want.
But this means now you can do like fully total and
I can do moderate
okay.
sedation. So I don't have a deep sedation license. I don't
Yeah.
pretend I'm an oral surgeon. There's certain medications I can't use.
Oh, okay.
We do have a
It's all
great
graded.
formula. Yeah, we have a great formula down. We do everything really safe. We monitor. You know, you've seen it.
Yep.
EKG, heart rate, blood pressure. You know, the whole thing. Oxygen, CO2, capnography, of course, right? Everything. So we have that all down. I even bring in a nurse sometimes to help me monitor just for harder patients. And, you know, we thank God we're nice, safe, and we have really great outcomes.
But if you want a full sedation, it means you have to call someone.
Yeah, if we ever need general anesthesia, we got to call someone in.
Yeah.
I have found very few and far. I mean, we've done it.
Yeah.
We've done it, but I haven't felt like we had to do it. You know, maybe a really hard double arch case where it's long, fine, but, you know, not even then.
But where did you grow up?
I mostly grew up in Jersey.
Oh, in Jersey.
Yeah, mostly grew up in Jersey.
You came to Chicago.
Yeah, the East Coast guy and came to Chicago. Though I will tell you, we get way more snow. We get more snow in Jersey.
In Jersey. Than Chicago?
Yeah.
But it's a windy city. It's
windy city. You got a lot more wind and a lot more cold.
But Jersey. But it's meant for school. You came to Chicago.
I got to Chicago for residency.
For residency.
That's how we got out of here.
Oh, cool. I was thinking from Chicago.
No, not Chicago.
All your relatives probably still there.
Yes. Well, majority.
Yeah,
majority on the East Coast, but I convinced somehow my wife's parents to move out here. So they retired to Chicago.
You have help.
So they go.
You have help.
They have help. Though they go to warm places, warm climates in the winter. They disappear for 3 months.
Do you remember any like funny or maybe not funny some patients in your dental school? Because usually I know everybody taking relatives, mom or dad or uncle, the first patient, to be easier.
Trying to think. I don't know about funny. I mean, you had patients. I mean, like you had characters.
Oh yeah.
You know, you get asked inappropriate questions all the time. I remember that. But I would say we had I think the most fascinating thing I saw in dental school was I saw a case of ANUG. So acute necrotizing ulcerative gingivitis. It's known as trench mouth. So it was really common in World War II because of stress, and on the front line, the soldiers were developing like these huge ulcerations of their gums. It smells like rotting flesh. It's dying flesh. It's really bad. You know it when it walks in the room. You're like, oh my God.
Really?
Oh yeah. It's like spoiled meat. You're like, what's going on? So I saw that in dental school. I remember seeing the case in what's it called? What do we call that clinic? I forgot. The intake clinic, we'll call it. So I saw that case in the intake clinic, and they wanted me to track it, and I went to Grand Perio, and they had me help on the case, and I learned, here's the protocol for that. It's very rare to see that nowadays. It was rare then. She had an immunodeficiency, that was why, and then she became my patient.
Wow.
So that was cool, getting to see that or being there. I told you about, I remember the patient's name, Alex, was a roundhouse bridge. My wife would make fun of me because I would have like dreams that the bridge would fail or something like that and wake up freaking out because it was like my whole ground requirement was this one bridge. No, we had all kinds of, it was North Philly, so you saw all kinds of inappropriate stuff and patients. We had a lot of HIV patients because we had the Ryan White program. So that was a patient that passed, or a kid that passed away from HIV that didn't get access to care. So if you had a patient with HIV in the state of Pennsylvania, basically their dental care was free. So we had that program. So I had a couple of HIV positive patients. So that was immunocompromised patients. And then we had a fair amount of patients addicted to drugs. So we had a lot of that. There were multiple times where it's like, hey, listen, I know your tooth's bothering you. Are you high right now? And they're like, yep. And I'm like, you cannot give consent. We can't take this tooth out. Wow. So we had those were hard conversations. But it was a big dental school. It was 128 in a class, and then 140 in total because we had advanced standing. So a big class. So there's a lot of patients.
How's for you was hard to like I didn't know about New Jersey when you come here. Is it like totally different or it's still
Chicago?
like
Um, Chicago's very different vibe than the East Coast in the sense that it's still a major metropolis, major city, but it's got what I love, like a small town feel. Is
Like-
way more friendlier.
really?
Yeah, way more friendlier than the East Coast. And it's just I know I'm going to get ragged on for this, but it's a slower way of life. It's like, everyone's take your time,
Take it,
right?
Not like New York,
we're not
because-
in a rush.
Yeah, because I
New York
have
is very,
I know.
very fast paced.
I have a lot of friends in New York, New Jersey, and every time, like in the beginning, I said, "Oh, let's move to Chicago." I said, "No way, we're never gonna move to New York. Chicago is too slow for us."
Yeah, correct.
Yeah.
It's a different mentality. And
you're
after
right.
being, I was in Jersey from '95, or the East Coast until 2014. It was almost 20 years on the East Coast, and it was just really refreshing to get out of it. My wife still misses it, and we go back. It's like you get your fix.
Oh,
It's
yeah.
like 3 days, got
That's
it.
it.
So
Go
now-
back.
It's like Vegas.
Yeah.
Spent 3 days.
I'm
That's
back.
enough.
I'm
I need
go
to
back.
leave.
Let's talk about nowadays. You have 2 practices.
Correct. Yeah.
How hard is it?
It's hard. I mean, it's a good challenge. I'm young. I'm up
I know
for it.
one was hard. Now 2.
Yeah, now 2.
Yeah.
I think any owner will tell you managing staff or staff issues, as you know.
Yeah.
You have a staff call out. I have a hygienist who loses a nanny. Like all this stuff. I think the other part that has been hard as a specialist is keeping up with the not the notes but the letters, right? So like case in point, last week, we have a life. So I saw Phantom of the Opera. Went downtown Thursday, but I'm not back into the office until Tuesday. Right. Last night we hosted a CE seminar. So I'm like running around dealing with that. Now Wednesday, okay, now I get to look and I'm like, oh man, I'm a week behind on letters. I gotta get these letters out. And so I think that's the hardest part is making sure in both places communication staying seamless.
What can somebody do instead of you? Or you have to...
We have a good system where we have someone remote in and draft the letter, but I have to approve the letter. And like in the end of the day, the buck stops with the doctor. So even though my note's locked and I'm like, oh yeah, this is the patient, like case in point, I had a patient the other day who came in for routine extraction, number 18, fractured off at the gum line. And she goes, Doc, I'm worried about 19. So what do you mean about 19? We're taking out 18. And no, I think I fractured this. I said, what do you mean you think? Oh, it hurts. It really, really hurts. So let me check. So I put her on a tooth sleuth. It hurts her when she bites. I probe. I angle the probe. I get 7mm probing. It's bleeding. And I'm like, I'm not going to take a CT. I'll send you to endo. You have an endodontist. Go to endo. She's like, I'm going to run to endo and come back. So endo made her available. I said, okay, I will try and accommodate you when you get back. She still wanted to take out the tooth. She runs to endo. Endo takes the CT. There's no sign of fracture. We don't know what it must be just overuse. They called it like occlusal trauma. So I was like, okay, come back. We'll take it out. I said, you know what? I'm going to flap it. Like, I'm going to extend my flap. I want to see what's going on. She had a little external resorption lesion that was going into the tooth that was infected. It had granulomatous tissue. So I just planed it all out and cleaned it out and put down back the tissue and then took the tooth out. She should heal fine. She should have nothing. But I have to communicate that all to the GP because he's not involved in these last minute because she already had an endodontist that he works with. So now I'm like writing the note and writing the letter being like, by the way, this is what happened in the middle of the procedure. Then she came back, then we did it. This is what I found. So it's just like, even if you have someone draft that for you, draft the letter, you have to add in the detail. So, it's
you're the main guy,
Yeah, so
exactly.
It's the buck stops with you. You can't make any excuses. You got to do the best you can.
How you try to do in your practices? You kind of like a mean guy, or you try to do like a family? Because I know it's totally two different stuff, and you have to be right in the middle, right?
Yeah, I think we try and run it more family style. I mean, worked for a lot of places where they run it kind of more like a dictatorship, and I don't think that works well for teamwork. So it's like teamwork. We still hold people accountable. I still have to write people up occasionally. Yeah. But we really try and be like, we're in this as a team. I can't do my job without you guys. You can't do your job without me. I say this all the time to our staff, especially when I'm interviewing staff. I'm like a family. I could kill my family sometimes. Exactly. But we're like a family.
Yeah, because at the
end of the day, we love our family. So we got to come back and all
Yeah.
work together
Yeah.
and get the goal done. And so I think we have a really good vibe. We've had, 5 years I've owned Glen Perio. So let's see, 4 years I've owned Glen Perio, but been there 5 years. We've had very little staff turnover.
Yeah.
Very
And
little.
this is the hardest part,
Yeah,
to lose somebody and find somebody.
Right, correct. We've had very little staff
It's good.
turnover. Like
Yeah.
I know some practices, unfortunately, where you're going through someone every 6 months.
Yeah.
We have not had that. I've had an assistant work with me for 18 months and then move on. But like, for the most part, I have three staff members that have been with that practice for over 18, 20 years. And then in the other practice that I bought, it's over a year now. So November of 24, we've had one person leave, and they left within a week or 2 weeks after we took over. We've had no one leave. We've kept everyone, and we've hired some staff. So that's the good news. I think the hardest part is that because they're separate entities and they're separate entities. That you can't. The patients are like, well, I'll just go back between the two. It's like, no, it doesn't work that way.
You just want,
they're separate business models. They're separate practices. They're completely separate.
Okay. Any cool cases? I know, like sometimes we do all the necks. It's more kind of complicated, but for and other sides, it's easy too.
Right. Yeah. It's.
I mean, it's so modern
treatment
now.
planning is easier, or it makes it easier because it's like, oh, look, I can get to a mound of bone, right? So, sometimes I feel like that's cheating on our own cases. Actually, I had a case that I showed a couple of my coworker doctors that I did the other day. I haven't drilled into it yet. I'm drilling into it next week. I'm very excited about it. But it's this massive GBR case that patient had 2 failed implants, and they were both about 16 millimeters long, and they were narrow. It was 11 and 12. Took out all the bone. Like, we're talking about the apex of the implants. I had one floating in space, right? So you're talking about massive defect. And it took out 70 to 80% of the bone on 13 on the mesial. So I took the implants out. I took the tooth out, and I just let everything heal. And I said, okay, we'll come back and do a really large GBR, guided bone regeneration, big bone graft. And the whole time that I was telling her this, I was like, look, I don't know if this is going to work. You've got nothing here. I said, but I will try everything I can to make this work. So I researched, and I bought a different bone graft than I normally buy. Like, I bought a living bone graft, like the cell with cells in it, that came from, it's free. It's frozen. It can be only ordered 2 days before you have to use it. It has to be thawed and rehydrated in a special process that takes 25 minutes. Like, it was insane. But it comes from the orthopedic side of things. They use it in spinal surgery for 15 years, and their studies looked incredible. So I mixed that with like some xenograft, BioS, and I put in 2 different growth factors. I put in PGGF and BMP. Like, I threw the whole kitchen sink at this thing. And then, of course, PRF, right? And I'm like, I don't know if this is gonna work. And she healed, she closed, she swelled a lot, she stayed closed the whole time. And I saw her at 3 months, and I was like, wow, it's looking pretty good. And I just saw her at 6 months, and it feels just as hard as my knuckle. I took a CT. I have all this bone in a place that did not have any bone.
Perfect.
So I'm gonna drill into it next week.
Okay. But what to do if patient, let's say, I don't have money, I can't do this kind of huge procedure because it's costs how much money. It's only what? Partial denture, right?
For that, yeah. For that's partial, and you tell them, like, listen, you're not going to be satisfied with a partial. Or, I saw a lady today, and she has 2 mobile canines on the lower anterior. She lost her lower anterior teeth. She's missing a premolar because of ortho. So she's got, basically 1 bite on each side, and then molars, 2 molars on each side. Everything is restored except the canines. Everything is crowns and root canals. And her partial is digging in a little bit. She has a acrylic partial. So I said to her, I was like, do you want to, I can't get implants, there's no bone. So that's true. So her canine's mobile, and she's not there yet. I said, why don't you do a bridge? Like, you do a bridge.
Okay.
I said, you could do a double abutment bridge, and eventually it's going to break, and when that does, then maybe you're more implant candidate. She goes, well, it's a lot of money to do that. Should I just wait till it breaks further? I said, well, listen, let me tell you, you lose these canines.
That's it.
That's it. You have 2 teeth that's preventing you from losing the rest of the teeth, because once you lose these, yeah, we can make you another partial, but it's going to be really rough, because she's got paper thin pyramid bone right here, so the lower anterior. So she said, listen, I'd rather than wait. I said, okay. If you'd rather wait, you're eventually going to lose your canines, and then then we'll talk about an all-on-X. Yeah, some people are like that.
But there's still a lot of patients, let's say, waiting. I mean, I know we're doing, but it's hard to say, like patients who want to have dentures.
Yeah, I mean, I don't know. I haven't seen a lot of patients elect for a full denture.
Oh, yeah?
I mean, at least the gold standard's a 2-implant overdenture. At least you can talk to patients about that. I mean, like, if I really like the person and I feel bad for them and they've been through a hellish dental journey, the way I operate is like, listen, we'll work with you on the money. We'll give you a discount. We'll do a payment plan.
But still to put a couple implants just to have.
We'll figure it out. To me, it's like, yes, there's a business side of this, but I'd rather take care of the patient. That's good karma for me. What goes around comes around. And so
I'm telling them, my kids every time laughing at me because it's I just saying this every time. And they're saying, stop. I said, no, it's true.
It's true.
Exactly.
So we've done charity cases. I did an all-on for, you were with me. I did an all-on for a family. The mother and the brother needed an all-on for all-on-X. So I did, the brother had mental handicap and the mother's like, no, I don't want it. Give it to the brother. So I think I did the brother for free and we charged for the mother. Just to help the family out. And so they were both really happy. They got 2 for the price of 1, or we significantly discount for some people just to help them out. I mean, like, listen, we can't lose money on a case, but we do help people where we can. And that's what we try and do. We try and take care of the patient the best as we can. And some of them I say, hey, look, the cost is here. If you can't do that, we'll do something else. But we go through all their options, but not a lot of people elect to go with a complete denture anymore. I mean, maybe in the maxilla,
it changed probably,
not in the mandible. Not in the mandible, because
it's never going to stay. I
say, what a floating denture is? Oh yeah, my friend, that's where we were at.
Exactly. Exactly. Besides dental work, what other hobbies do you have?
I don't have time for other hobbies.
Yeah, kids and family. It's the biggest hobby I know.
4 kids, and so mostly.
But I know you like sport.
I do like sports. Yeah. I watch a lot of sports. I follow a lot of sports. I used to play sports until I realized that, this is a funny story. I broke my finger in dental school. So it was my freshman year, it was D1 year, it was spring semester, and that's like known as the drill and fill year in everyone. So you're prepping. You're learning how to prep a crown. You're learning to do boxes and fillings and class 5s, and I broke my finger playing basketball. I jammed it, or maybe I think it was basketball. I couldn't remember. It could have been football, but I jammed it really badly. That's what I thought. My finger swelled 3 times and turned completely purple. And so after a couple of weeks of it not getting better and me not having time to go to the doctor, my wife yelled at me and said, you're there, go to the doctor. So I walked in to the emergency room and I found out it was broken. And then I was like, you got to tape it. You got to tape it together, not much to do. But they had to cut off my ring because they couldn't, my ring was so swollen.
Really?
Yeah, I had a chip fracture. I still probably have a little bit of it in my knuckle, basically. And so right then and then, the orthopedist that saw me was like, maybe if you need your hands for a living, don't do anything like that. No more sports. That's when I stopped. I stopped in dental school. I stopped playing because it was like, and I still don't. So I don't go skiing or anything like that. Yeah, no, I'm really adamant about it. My hygienist went skiing. She unfortunately fell and ripped her knee. She shredded her knee. She tore her ACL. And she was out 8 weeks. And I was like, so I'm fairly careful with that. Just trying to take it easy. So I don't do pickleball or stuff like that.
So it's not gonna enjoy our tournaments.
Yeah.
But if you move from Jersey to Chicago, did you change your favorite teams, or it's like
no.
professional?
No,
it's still.
So my teams are all still the same. I'm only one Jersey team, well, one New York team. I'm a Yankee fan,
Uh-huh.
but
Okay.
I wasn't born in Jersey. I lived in Denver before that, and so I'm all Denver sports mostly. Yeah. So
Broncos.
Broncos,
Really?
yeah,
Even hockey
Broncos,
too?
Avalanche, yeah,
Wow.
yeah,
I did not know.
yeah, and Nuggets, yeah,
Wow.
all those. So I do a lot of sports. Um, I do a lot of Lego building. Shockingly,
Like Lego?
Lego. Yeah, with my wife, we do like a date night when the kids go to bed, and we take out
Wow.
Lego together. She really loves building Lego, so I got into it.
That means you
More
have
for
so
her.
many.
We have a lot. She actually built the entire Hogwarts scene.
Really?
Yeah, and I've built I'm a kid of the '80s, so I built a couple of Transformers, and I'm in the middle of this huge diorama of Spider-Man, and I have this Zelda one that I do. So we do a lot of Lego. We used to do in COVID. We started doing like a murder mystery box.
Okay. Yeah.
It's called The Hunt a Killer, so
Uh-huh.
we do those. And it's because we try and get date night where we can. And then the other thing that we do a lot of with the kids, because the kids love to pottery paint. So we do a lot of pottery painting, but because I'm crazy and I'm a perfectionist, and it takes me a while. So I go back multiple times to finish my piece. So I like made this one Darth Vader. And I put it in a display case in my house, and people are like, "Oh, where'd you pick up the Vader?" And I was like, "No, I painted that."
Wow.
And they're like, "Seriously?"
You don't have to buy any more plates, cups. You already can do by yourself.
Yeah.
It could be your another
so
business.
We used to do it. No, it's not another
No.
business.
But it's fun, probably,
It's
right?
fun. It's fun. And then my wife has started like a small business on the side of resin pouring. Are you familiar with that? Right. So she's made all kinds of bowls and containers or trays. Like, so when we get invited out for places, we make a little goodie tray so that they can keep it, So she's like, "I saved you money." I was like, "That's girl math."
So good.
That's okay.
If you have time beside the work, family, or with family, what's your favorite places to go?
Like in Chicago. Oh, traveling?
Yeah.
I haven't traveled in a while. I do love going to Vegas. Internationally, we go to Israel, or we would like to go to Israel. I would love to go to Greece one day. Haven't been there. We're going to go to Panama this fall, so that's going to be exciting. With kids. It's hard to like. My kids are young. I have 4, 10, and under. So
you
it's
can
like
do without.
Traveling without kids is going to be in 10, 15 years. Yeah. So, I mean, like because we have little kids and we're a Disney family. We go to Disney a lot.
Really?
So those are big trips.
And you stay this
crazy line,
and you stay this crazy lines.
Yeah, we get a private tour guide.
It's it. Yeah, because we went couple times and after said no, or we're gonna buy this private tours, or I'm not gonna go.
Yeah. So because, I mean, like we don't do the whole thing that way.
No, impossible to do the whole.
We do one day, but it's a long day. It's like a 12-hour day.
I know.
It's so the kids get to do everything they want, and then we can dray around the parks the other days, that kind of thing. So we just did a trip to Universal and Disney in November, and it was great. Don't get me wrong. I would definitely recommend Epic. It was a fantastic park.
Just for a weekend, like 3, 4, 5 days.
Yeah, we went for 5 days, and we did. Because my kids are really obsessed with Harry Potter. So we took them to Harry Potter worlds, and we bought them robes and wands, and your hobbies become your kid. What your kids like.
That means they went to downtown to the store too. It's still lines outside in
Oh
Michigan Avenue, right?
We've been downtown. Yeah, we've been downtown.
Wow.
Been downtown. Actually, my girls have a shirt that says Lumos and Knox that they loved wearing that we bought them from downtown. But those are like, I swear to God, going to Disney or Universal is like going international with these children because of the stuff they buy.
I know. Go back to dentistry. I mean, time has changed. Digitally came. All technology. What do you think about it? I mean, it's even 10 years, everything changed.
I love, in 10 years, it's going to change even more. So I love, me, I love digital dentistry. We're specialists. We're trained to be able to do surgery and place implants and not need guides. I do every single implant with a guide. Why? Because it's easier. It's faster surgery. It's cleaner surgery. It makes it easier for the patient. I don't have to re-angle. I know my angles are good. And as much as surgeons, oral surgeons and periodontists don't want to admit it, like implants are really restoratively driven. They have to be surgically oriented or placed, but they're restoratively driven. So I got to be in the right spot for our referrals. for our doctors. Otherwise, I'm not helping the patient. I'm not helping the doctor.
Exactly. Yeah.
But so I use we have digital impressions. So we have a Trios 5. We have a 3D printer. You know, we have I love laser technology. So we have a full laser that we use for periodontal disease. You know, not a lot of periodontists are doing that in the area. There's some, but not a ton. It hasn't penetrated into the market. So we do a lot of digital or a lot of technology in the office. You know. And when I took over the second office, you know, they didn't have digital X-rays, brought that in, didn't have the laser, brought it in, brought in the 3D printer, brought in the Trios 5. I just don't think we're there for a full digital yet.
Yeah.
I mean, like, I did one of the first stackable cases in Chicago within Sequence. I did it in residency. I beat Dr. Rosenfeld by like 2 months. It did not. I mean, like I was a resident, so yeah, I could say it did. But it did go well because the guy didn't fit. You know, I did a lot of cases when I was working in Wisconsin. We had problems with the guy under the denture fitting. Like, I had 2 cases that went flawless, and it was like, whoa, yeah, it's time saving and it's great. But I don't know if I'm doing an all-on case, and maybe this is just me. Like, I don't need to see 16 patients afterwards.
Exactly.
It's a hard case. I just want to do that and get an easy day. I made more than enough money, you know. I want to see my family too. So, but I don't think, you know, surgical photogrammetry and printing. I know a lot of people do it, and I know it's there, but they have their challenges. You know, I work with a prosthetist who's an excellent prosthetist, but he had trouble picking up the mandible, and you know, it took longer and longer, and you know, and then we can't take anything off until the lab approves it. We're waiting for the lab to design it. That's 20 minutes and 30 minutes in Slack that they're going back and forth, and finally, like, it interrupts the whole surgery. And so, like, I can't suture, I can't move forward until we're ready, you know. So I think it's great. I think we're not fully there yet. I think the materials, I think if you ask the labs that are around that are 3D printing with Onyx Tough and all, they're like, oh, that's better than 2 years ago. This is so much stronger.
Exactly.
But the problem I still have is it's printed resin. It's never going to be as strong in the temporary as set acrylic. Yeah. And so acrylic is always going to be stronger than a printed resin to me. And so, like, I don't know. I don't trust patients sometimes. I'm skeptical.
100%.
You know?
100%.
I have one lady that can't stop clenching. We talked about the case today, and she keeps breaking her temporary. And it's like, what are you eating, rocks? Yeah. You know, if I put in a printed resin appliance in that, it would have been gone. So, you know, I don't know.
It's coming.
It's coming. Yeah. It's just not fully there. I do love photogrammetry for the. Yeah. I've seen it for the restorative side. You know, in a couple of cases where I've had it in family members or something. It's great. Don't get me wrong, but I just don't know if it's there yet because we haven't seen a way to pick up as easily because of the bleeding.
Yeah. New generation of dentists coming from schools. What your advice for them, because it's time is different. And probably every 10, 20 years, it's like everything's different.
Well, don't just buy technology because of ROI. Everyone will tell you that. You know that. Yeah. That would be one. Don't buy technology because of ROI. Think it through before you want to take it on, because there are cases, even as a specialist, I'm like, God, why did I take this patient on? You know, like, why did I do this to myself? So think it through before you take it on, and then know your limitations. Like, you know, as a periodontist, you know, I don't want to take out unpacted thirds. You know, like I want to work with my colleagues. I want my oral surgeons to do that. I don't need to go into that sandbox. And so sometimes I think newer grads are so excited to take on everything, so excited to do everything, but make sure you're doing what's best for the patient. Don't lose sight of that. We had hired a new associate doctor, and she's great. She's fantastic, but she's like a new puppy. She's so excited to do everything. And she's like, oh, I can do this. And I'm like, well, where's the bone? What are you doing? Like, hold on. It's in there. Yeah. And so when, you know, it's getting her to be like, take a second and don't lack confidence. You got to have confidence. You got to portray confidence to your patient, but don't be overconfident that you can over deliver. Don't ever, you know, don't over deliver and undersell, right? Yeah. You know, you want to take your time, explain things to patients and reset expectations. That's the hardest part of our job, is just telling people, hey, listen, what you want, I understand you want that. It's not possible. That can't happen. We can't do that, you know? sorry, you have no bone there. Like we can
Yeah.
grow, you have really bad periodontal disease. I'm sorry, you're going to lose this tooth. Like, you know, you keep it, it's going to cause more problems.
Yeah.
You know?
Well, Doc, I know it's so busy. Thank you so much for coming.
Thank
and
you.
we're gonna have probably many more. We're gonna find somebody even
Look forward to it.
more, and we'll do it.
Thank you
so much.
Thank you.